Hello and welcome to the AMA Update video and podcast. Well, we're approaching residency application season already, and today we're talking with an expert who's going to give us an inside look at how she selects residents, weighing things like preference signaling, personal statements, and more. Our guest is Dr. Deborah Clements, Chair of the Department of Family and Community Medicine at Northwestern University Feinberg School of Medicine, and the founding program director for the McGaw Northwestern Family Medicine Residency at Lake Forest in Chicago. I'm Todd Unger, AMA's Chief Experience Officer, also in Chicago. Dr. Clements, welcome.
Thanks so much, Todd. Thrilled to be here.
Well, we're going to get into a variety of topics and some of these insider secrets. And why don't we start with one of the biggest changes to the residency application process in recent years, and that is preference signaling. In fact, your specialty, family medicine, started using signaling just last year. So Dr. Clements, when you review applications, how do you now take into account signaling into the process?
For most of us, I think regardless of specialty, the number of applications that we receive exceeds our capacity to interview, even many qualified candidates. So we make assumptions based on applications as to who might come to our programs. The ability to signal programs prior to an interview has really given us the opportunity to potentially invite candidates we may not have previously considered. If you're from California and you tell me you're interested in Chicago in February, maybe not, unless I have a reason to believe that you are. And so signals can help with that.
What could you say to convince someone that you really are interested in being in Chicago in February? I don't know. But based on that, what advice would you give med students on how to make the most of their signals?
I would say use your signals to express your true interest at the time of your application. We understand it's just the beginning of the process, and you're operating under assumptions just like we are. You may choose to rank us further down your list or not at all once you're through the process, but signaling sends us an intention that might increase your odds of being offered an interview.
Any specific kind of signaling that's caught your eye in the past?
Truly, those candidates that come from places where I wouldn't expect. We have an adage, there's no such thing as bad weather, only bad clothing. And so it really does help us to pin down those people who have a true interest.
All right. Well, speaking of personal preferences and background, I'd like to get your perspective on the personal statements. There's always been a lot of debate about the best way to approach them. Is there anything in particular that you'd like to see in personal statements, and what should program directors be looking for to really make a student stand out?
Sure. To me, a well-crafted personal statement really weaves together all the other components of the application and gives context to the candidate's unique journey. The personal statement should compel me to want to get to know more about you, help me understand your motivations, your mindset, your approach to challenges. Have you been self-reflective about your journey through medicine? If you had challenges, do you address those in a way that helps me see that you've grown through those challenges? Highlighting your achievements and also outlining your future direction and your intentions. I want to see where you envision yourself, how you'll both gain from the program, but also how you'll contribute to my team, my specialty, and perhaps even the body of knowledge in medicine. It's a lot in a personal statement, but I think if well done, can give me all of that information and again, compel me to offer you an interview.
Well, that's a good framework to think about that. In addition to the personal statement, there are other areas of fit, like hobbies and interests. How important is that section to you, and how do you use the information that students share there?
I think this is a secret, often disregarded section that I pay attention to. I use this section to help me establish a rapport with someone when they comes in, to find maybe some commonality in interest or explore an interest that I know nothing about. It's completely normal to be nervous during an interview, and being able to talk a little bit about yourself, your hobbies, what brings you joy outside of medicine, can reduce that anxiety and give me a window into who you are as a person, contribute to your holistic review.
A not surprising question from somebody at the AMA, but when you see an applicant that is heavily involved in organized medicine, either with their state, society, or with the AMA. How do you account for something like that?
I think that's an attribute that really exceeds lots of other things. It tells me you both focus on your work as a medical student, but you understand the role of a physician in society. You understand your impact on medicine writ large, and our responsibility to the public. And so choosing those leadership roles, whether it's just being a member of a committee or leading a commission, those things are just huge to me. I look at that. I also look at, were you an athlete in college, in medical school? Because I know you know how to function on a team and you understand team dynamics. So both of those things I think are critical.
Great perspective. Do you find any particular part of the application you wish students paid more attention to or thought differently about?
When we ask about the most impactful experiences you have had throughout your training, I would really hone in on that. And again, think about that line on your application and how that helps me understand who you are as a person, what your motivations are, and how you choose to spend your time. It's great if you're a gamer. That doesn't help me, right? And so I'd leave that off your application. I want to know about the volunteer experiences you've done. And again, the research that you've done, how you've contributed to our field.
All right, that makes a lot of sense. Dr. Clements, you shared so much helpful advice. If students only take away one thing from this discussion, what do you think it should be?
Authenticity and congruence in your application, your story are absolutely critical. As a resident, you're going to be an integral member of my team. You're going to care for my patients. And it's a relatively small team that depends on one another. And so I want to know that you're trustworthy, that you're going to be there, and you're going to be all in on your education. Do we have values alignment? This, I think, is the most important piece. You'll hear people talk about fit, and it's really about congruence of values. That in that way, you will find the best program for yourself, and we'll find the best resident for our program.
I really like the way that you're explaining that. I think a lot of people maybe are thinking about how to talk about themselves so much, but it's really about how are you going to be a part of somebody else's team and help them with their patient objectives. So I think that's really great advice. Thank you so much for joining us today, Dr. Clements, and helping both program directors and students get ready for this huge milestone every year. The AMA also has many resources to help with MATCH, including FREIDA, the AMA's residency program database. You can start your search at FREIDA, that's FREIDA.ama-assn.org. AMA members also have access to a personalized dashboard where you can save, rank, and compare programs that you find. That wraps up today's episode, and we'll be back soon with another AMA update. Be sure to subscribe for new episodes and find all our videos and podcasts at ama-assn.org/podcasts. Thanks for joining us today. Please take care.